Autoimmune disease, conceptual history, and contribution of ocular immunology. Medical historians identified the mid-20th century as the time when the scientific and medical communities acknowledged the existence of autoimmune disease. Several conditions, including the sympathetic ophthalmia and endophthalmitis paquanapalatica, however, were proposed as autoimmune disorders much earlier. During the first half of the century, autoimmune disease was viewed as biologically impulsive. Paul Ehrlich coined the term horror autotoxicus to emphasize that autoimmunity would contradict nature's aversion to self-injury. The discoveries of allergy and anaphylaxis were the first clues that immune systems were capable of self-harm. Common signs and symptoms of grave disease include anxiety and irritability, a fine tremor of the hands or fingers, heat sensitivity, and an increase of perspiration or warm, moist skin. Weight loss despite normal eating habits, enlargement of thyroid gland or goiter, change in menstrual cycles, erectile dysfunction or reduced libido, frequent bowel movements, bulging eyes, fatigue, thick red skin, usually on the shins or the top of the feet, rapid or irregular heartbeats, sleep disturbance. Autoimmune disorder in general cannot be cured, but the condition can be controlled in many cases. Historically, treatments include anti-inflammatory drugs to reduce inflammation and pain. To reduce inflammation, they are sometimes used to treat an acute flare of symptoms, pain-killing.
Our immune system is the complex of cells and tissues throughout our body that work together to defend and guard us from germs, viruses, bacteria, and infections. It tries to identify, destroy, and eliminate the invaders that might hurt us. Autoimmune disease refers to the problem with acquired immune system's reaction or a condition in which our immune system mistakenly attacks our body. Immune cells target the body's own healthy tissues or cells by mistake. Autoimmune disease can affect almost any part of the human body, including the heart, brain, nerves, muscles, skin, joints, lungs, kidneys, glands, blood vessels, and so much more. Many autoimmune diseases can affect more than one part of the body. It is still not sure what causes the autoimmune disease, but probably genes and the environment plays a great factor. This autoimmune disease includes Sjogren's syndrome, which attacks the salivary and tear gland, rheumatoid arthritis, which attacks the joints, lupus that targeted the heart, lungs, muscles, and many other different body systems, type 1 diabetes, which attacks and destroys the cells in the pancreas, Hashimoto thyroiditis, and Graves' disease, which attacks the thyroid cells. In the YouTube video, Megan Roosevelt had Graves' disease, which affects her fertility. Graves' disease is a condition where the thyroid gland makes too much thyroid hormone. This is called hyperthyroidism or overactive thyroid. She has difficulty in getting pregnant because hyperthyroidism can have a negative effect on fertility and make conception more challenging. As she said in her video, she was given 3 options. It is either have her thyroid removed, radiation, or medication. With that being said, stress reduction is a very important component for our overall health. It is important to consult with a healthcare professional if you're feeling unwell to prevent more serious condition and for personal healthcare needs and guidance.
Graves' disease is a autoimmune condition that can result in hyperthyroidism or an overactive thyroid gland. Thyroid hormones control how your body uses energy, so they affect nearly every organ in your body, including the way your heart beats. Hypothyroidism is a common endocrine disorder caused by a lack of thyroid hormone. Graves' disease is a condition in which your immune system destroys your thyroid gland, causing it to produce more thyroid hormones than your body needs. Many of your body function will speed up as a result. Graves' disease affects more women than men. It most commonly affects adults between the ages of 30 and 50. The disease is known to run in families. Graves' disease, if left untreated, can lead to a variety of health issues including a fast and irregular heartbeat that can cause blood clots, stroke, heart failure, and other heart disorders. Bone weakening, osteoporosis, external link, and muscle aches and pains. Menstrual irregularities, infertility, and pregnancy are among issues that women face. Discomfort in the eyes and alteration in eyesight. How does grave illness affect eating food and nutrition? Iodine is used by your thyroid to produce thyroid hormones. If you have Graves' disease or another autoimmune thyroid ailment, too much iodine in your diet might cause serious side effects. Hyperthyroidism can be caused by eating food in high iodine, such as kelp, dulse, and other types of seaweeds. Supplementing with iodine can have the same effect.
The woman in the video is suffering with a disease called autoimmune Graves' disease. This disease is the most common cause of hypothyroidism overall and is more common in women than in men. This involves the thyroid gland becoming overactive, which means that your thyroid glands is much more higher than the normal level of normal people. Now, as she got diagnosed with this disease, she was given 3 options. The first one is to get surgery to get her thyroid removed, which is permanent. The second was to get radiation, and the third one is to keep medication. She is a dietitian, decided that I want to explore more of this, I want to do more research, I want to see if food can help me with my disease, because she believed that food can be a natural medicine or a natural medication. So what she did was she did a lot of tests about food allergies, she met a lot of doctors, she went to a naturopathic doctor to help her with her self-healing process, and she followed a strict diet for over 2 years, and luckily enough for her, one day she asked her husband to buy a pregnancy test, and it was positive that she was pregnant. Now, what is the endocrine connection? The endocrine connection is that the autoimmune disease occurs when the body's immune system starts to make antibodies which target area of the body that they should not. Usually the immune system is supposed to protect our bodies and help fight disease. Antibodies in Graves' disease, which is a thyroid-stimulating hormone receptor antibodies, primarily target the thyroid gland. In response to these antibodies, the thyroid gland becomes overactive and starts to make too much thyroid hormone. So what she did was she focused on getting her immune system better with her new diet, which was avoid sugar as much as possible. She would eat greens in her diet, but would also add in fish every now and then to balance it out. And it really did have a great effect on her immune system. She also did calming exercises to be able to control her thyroid levels.
In the video, Megan's condition is called Graves' disease. Before we get to the disease itself, first, I'm going to give a brief explanation of the thyroid gland. The thyroid gland is a small organ that's located in front of the neck. It's shaped like a butterfly, smaller in the middle with 2 white wings that extends around the side of the throat. What it does, it's releasing and controlling the thyroid hormones that controls metabolism. This is supervised by the pituitary gland. It monitors and controls the amount of thyroid hormones in the bloodstream. If the gland senses a lack of thyroid hormone or high-level hormones in the body, it will adjust with its own hormone. Going back to the video, Megan can get pregnant because there's something wrong in her thyroid levels. After all the tests mentioned, she's diagnosed with Graves' disease from hyperthyroidism. Her body produces too much thyroid hormone which can damage her heart and other organs in the body. Experts don't know the cause of this autoimmune disease. The triggers of this may be a combination of genes and exposure to virus. PSY, thyroid-stimulating immunoglobulin, tells the thyroid glands to become more active and release excess amount of thyroid hormone into the blood. It attaches itself to healthy thyroid cells, causing to overproduce. The pituitary gland plays an important role in the fertility by releasing 2 hormones directly responsible for ovulation. Follicle-stimulating hormone stimulates the growth of eggs during the menstrual cycle. A woman ages and the number of eggs declines, FSH levels increases. The increased levels can indicate that she may have diminished ovarian reserve. Luteinizing hormone tells the ovaries to release a mature egg. This process is called ovulation. The anti-Mullerian hormone is the most sensitive hormone marker of fertility potential. It is produced by the granulosa cells which surround and support the early developing eggs in the ovaries.